Hello, everyone, and welcome to the Dr. Tamara Beckford Show. I am super excited today. If you have not heard, if you have been under a rock for the last week or so, we have our 200th guest. This is our 200th, yes, our 200th physician guest today, and I am super excited to have her on. We're going to really dive into something that it's one of those things that people are dealing with in secret. You know, it's one of those things that unfortunately it makes people feel ashamed to talk about it.
Correct.
Do you know anyone who's been having difficulty having children? If you do, then good. If you feel like you don't, you probably do, and that person is just not letting you know. Why? 1 out of 5 people are having issues with infertility.
Correct.
1 out of 5. So we are going to delve right into this today and really try to help those out there. Now, let me bring my guest on because she just has so many accolades. I love this woman to death, and she's just so brilliant. If you have met her in person, you know what I'm talking about. If you haven't, hey, welcome. Welcome to this wonderful, brilliant lady. Let me tell you all about her. So my wonderful guest today, she's a graduate of Emory University School of Medicine. She did her OBGYN residency in Georgetown University. Then she did a fellowship in reproductive endocrinology and infertility at the NIH. She is the founder of Montgomery Fertility Center, and she's an associate clinical professor of OBGYN at George Washington University School of Medicine. She believes that empowering women helps them to make the right choices for themselves. She launched the most diverse egg bank in the Northeast, helping patients from all backgrounds to complete their families and putting donor safety first. She is a champion for those who are minority families looking for donated eggs. Why? Because if you don't know the statistics, for those who are looking for minority family donated eggs, the families that are looking, it can take up to 3 years. 3 years in order
For the embryos.
find an embryo. Yeah, it's just really heartbreaking. And you know what? She's here to help. Who am I talking about? I'm talking about the one, the only, Dr. Oluyemisi Famuyiwa. She is here to help. Yes. She's going to make that statistic go away. 1 in 5, no more, no ma'am. Thank you so much, Dr. Oluyemisi, for joining us today. How are you?
Fine, thank you. Thank you very much.
Hey, I am so honored to have you as my 200th physician interview here on the Dr. Tamara Beckford Show. Now, you know, we usually go deep into what's going on with the business and all the wonderful things you're doing inside and outside of clinical medicine, but we need to know, how did you get to this spot right here? So tell us all about what made you decide to be a doctor in the first place.
Oh gosh, that's quite easy. I've always wanted to be a physician. I think from my childhood years. I mean, that was from when I was like 8 years old or 6 or 8 years old. That was
Mhm.
the only thing I ever wanted to do. So that was a no-brainer. I was laser focused on what I wanted to be.
Wow, from 6 to 8. Like, was it something that you saw that made you like, you know
I'm not sure. I think I just have always that was the only thing I ever wanted to do. There was no dilly dallying, or
what? Mhm.
I just was laser focused when since I was a child. Yes, so all my footsteps just led to that one path. Um,
Love it.
yes.
Love it. Love it. All righty. So there you are, as a child working towards this. And it was just like, you know what? This is it.
Yep.
I'm single digits, 6 or 8 years old, around that time frame. I'm going to do medicine. So now, as you worked towards this and you're in medical school and you're like, yes, I'm here, right? There's so many different specialties out there, but you chose OBGYN.
Correct.
What made you decide to choose that
Oh
section?
dear. That one, the simple answer is when I was in medical school,
Mhm.
I think I enjoyed everything. I liked everything. Everything was fun. Um, no, I take it back. Radiology was boring. Boring. Radiology was boring, but I liked everything was fun.
Mhm.
So, when you get to third year of medical school, when you have to decide what to choose, so it became a problem trying to figure out what to choose.
Mhm.
So, one of the ways I narrowed it down was to simply ask the question, what do I have fun doing?
Mhm.
And the minute I asked that question, it was like, bam, a no brainer. It was fun. I enjoyed it thoroughly. That's what I wanted to do. Now,
Wow.
yeah. So it was that. That was what made it easy to select a specialty from medical school going into residency. It was like
Mhm.
I liked everything, but what was fun? What was pure joy? That is was a no brainer for me.
I love it. So a lot of people, when they hear about OBGYN and they're thinking, well, I like the fact that I get to do the surgical part and then there's the clinical part and I get both sides. Was that what pulled you to? Was like what part of it that was just like, this is fun? I love
Well,
it.
I mean, I don't know if you remember when you were in medical school and you were delivering babies. What can be more fun than that?
That's
I
true.
mean, it's
Joy.
just pure joy, pure fun. Um,
Mhm.
there was no calculations about it. It was just simply what was just fun to do, right?
Mhm.
Um,
Mhm.
watching labor, babies being delivered. That was just, for me, was just what do I enjoy? What was
Yes.
pure fun? And when I answered that question, I knew immediately what I wanted to do. It was a no brainer.
So now you've decided on OBGYN, but then you did a fellowship
Correct.
in, yeah, endocrinology, and so which would be reproductive
Reproductive
endocrinology,
technology and
yeah,
endocrinology.
and infertility.
Yes.
So what now made you go towards that end? Because a lot of people would think like, oh no, be able to catch
All right.
babies. Oh, that is so
All right.
awesome.
So from residency to fellowship, reproductive endocrinology is a very intellectual field. It's more academic oriented.
Mhm.
So it was just curiosity, getting down to the nitty gritty, the pathways of molecules working, the pathophysiology. That to me was fun, right? So fun on a different level. You may think it's nerdy, geeky, but reading out and how can I explain it? I'm sure if somebody said, "Did you enjoy the Krebs cycles?" You'll probably say no, but if you
You
kind
did.
of but if you looked at it from what were the receptors and what were the downstream
Mhm.
signals and how did it hit the nucleus and how was that signal translated into the protein and then giving you the response? So if you go beyond and go dive deep down on a
Deeper.
nano level, that
Mhm.
is a whole different level, a whole universe, and that universe kind of sucked me in. So
Mhm.
to me, then it became the science of it was more exciting, if you will.
Wow. So when you really look at it as a whole, we went from the broader into the deeper portion. The broader part is, yes, I love the fact that babies are being born, helping to deliver, this is the end product. Like, wow, this is joy, this is life. Look at what just happened.
Right.
And then you started to get pulled deeper into how can
Yeah.
we help that from the standpoint. Now, as you mentioned, when you really get into the molecular portion of it, you
Right.
realize that there are people that are having challenges
Yeah.
And from that molecular standpoint, it allows you to look and say, well, which part of this step
Yeah.
is causing this challenge,
Right.
right? And
So it's more, pure love of basic science at that point, right?
mhm, mhm,
And I was very blessed with being able to participate in bench research with my mentor, who is now, late, um,
mhm,
Dr. Carolyn Bondi, who, believe it or not, was actually an internist,
mhm.
but a medical endocrinologist, actually. But at that time, she wanted her lab to venture into the world of reproductive endocrinology. And
Wow.
so she was so happy to grab me out of the fellow pool and say,
Mhm.
okay, I need to start this part and I want you to spearhead this. So, and this was an incredible woman. She's the kind of person who you gave data to on a Friday night, and Monday she had a scientific paper reference.
Oh, wow.
Yeah, that's how prolific she was. So to be pulled into her realm and to her
Mhm,
mentorship was fun because that's what we did in the lab. It was just I can't explain that level of joy.
mhm,
It's almost like how would I liken it? When you give kids Play-Doh
mhm,
or a Lego set and they get so engrossed in what they're doing, the whole world dissolves. Well, that's what bench research was for us
mm.
under her mentorship and tutelage. It was fun.
Oh, I love it. And it also goes along with when you have a good mentor, like
Yes,
you see the product of the mentorship. It goes way beyond the encounters
absolutely.
at that time,
Absolutely.
because based on that time and the love and the passion
Yeah,
that your mentor had, that she passed on to you, you're
correct.
now able to use that passion to help others in this wonderful practice of yours. So tell us, when is it that you decided to open up Montgomery Fertility Center, and what was the driving force behind it? Like, what is it that
Um,
you saw around you, and you're like, I need to do this?
so we got to a point because I finished my fellowship, but then I stayed on at NIH doing research,
Hmm.
and then I also started the GYN clinic there um,
Hmm.
because I wanted to see these patients and acquire patients for my board exam.
Hmm.
So, and she gave me free rein to do it. And I was able to partner with some physicians out of NCI who were
Hmm.
GYN oncologists. So, if I needed to do complicated surgical cases in the OR, I could pull them along. When you have an expert surgeon, it makes you feel brave, like you can do anything.
Absolutely.
So, and they were willing also to help in that regard. So that was easy.
Hmm.
And then I was doing the bench research, and we were both doing on-site enough. There's a primate center that NIH had, so it was splitting my time between those. So I got to a point where the bench research was extensive. I mean, we were going to national conferences and at endocrinology conferences presenting data, and it got to a point where I felt that was going. I could just stay and do that forever and a day.
Hmm.
But then I started really missing more of the patient care,
Hmm.
right? And I didn't want to let that go.
Yeah.
So then I looked into things I could do post employment and got offered a research position with Monsanto, but that was in Chicago. And they said, well, you
Hmm.
could do some clinical stuff out of Northwest. And
Hmm.
but then my husband didn't want to move. So I said, well, forget that. I got another offer. I could look at the FDA. They
Hmm.
had a research arm, and I decided I just didn't want to be reviewing papers and studies and
Hmm.
still miss the patient care. So I decided, well, let me go back into that. And at that time, believe it or not, the field of REI was not as broad as it was, and there were no openings in this area. So I spoke to two of my mentors, and one of whom is my absolute hero is Dr. Valerie Montgomery Rice, who, by
Mm-hmm.
the way, when I was a third year student, was an intern at Emory. So we were on the deck, right? We were through the trenches, and just a dynamic, fun, fantastic, phenomenal person. And
Mm-hmm.
she went into REI as well. And I would run into her at conferences, and I told her about what I was thinking of. And she said, "Why don't you start your own?" I'm like, "Huh?" She said, "Yeah, start your own." I'm like, "Really?" And I said, "Okay, I'll think about it." And then I spoke to Dr. Simon, who was an attending at it. When I was a resident at Georgetown, he was the in charge of the Division of Reproductive Endocrinology, and he was now doing research in a private setting. I
Mm-hmm.
mentioned it to him, and he said, "Okay, well, just start." And so I said, "Okay," put some resources together and started. Really, just started.
Mm.
Starting on my own gave me the flexibility because at that time I was also a new mom per se,
Mm-hmm.
and
Mm-hmm.
it gave me the flexibility of being able to carve my own time.
Right.
So I could, bring my baby to work with a nanny. I could, close the office and go be with her. I could, I had that flexibility without having
Absolutely.
to account to anyone. And at that time, that was important to me.
Mm.
So everybody has to look at what's important and where they are in their journey. So at that
Yeah.
point, that was important to me.
Love it. Love it. So now you're there, but then you're starting to notice some alarming statistics,
Yeah.
especially about egg donation.
Yes.
And, you're such a champion for that. Now, for those who are watching, you're probably like, oh, yeah, her clinic is there in Maryland. It's nice. This is a state of the art. It likens some of the Ivy League center. And Dr. Oluyemisi's clinic is not just a, okay, well, you can go and then you'll do your surgery over here and then you come back. It is all encompassing. So tell us what you can do in your clinic and why you set it up that way.
So I didn't just leap into this
Hmm.
clinic per se. So when I started out, I was actually taking my patients for retrieval in a separate clinic. So I didn't have to have my own lab. I didn't have to have my own embryologist. So I was allowed to use the lab that was out of suburban hospital. But then the hospital decided that they didn't want to run the lab anymore, right?
Mm.
And we got like a 24-hour notice that, or a week, that they were going to
Wow.
close. So I called a friend of mine and I said, "Gee, I would like to see if I could bring my patient." He was so welcoming. He was my chief resident when I was an intern at Georgetown. And he was like, "Oh, sure, come on, Yemi." And so I took my patients there and gradually worked my way to where I was able to put a lab in a surgery center, so I didn't have to build out the surgery suite. And that gave me the time to gradually build up my lab and my own surgical area the way I wanted it. So that, um, and one of the things I did when I was starting out was some of the instrumentations were starting to go out of style, and the field was moving into benchtop incubators. So that was fun because I didn't have to buy the old incubators that are not as efficient. And I
Mhm.
decided I wanted to go in with the new. So called up Origio, and it wasn't Origio then, it was Mid Atlantic Diagnostic, and it was a father and son outfit. And they were extremely supportive and excited that, wow, you want to do this? Sure, we'll help you. We'll sell you a microscope. We'll get you a first benchtop. They came in, designed the lab, put it in. And once I got my initial setup and some of the equipment I had anyways,
Mhm.
rather digress, my a good friend of mine who was also the lab director at Suburban Hospital, when it closed, she went to University of Maryland, and that lab closed as well.
Oh,
So she
wow.
had called me and said, "Well, the lab is closing. Do you want this equipment?" I'm like, "Oh, yes, I do." So she said they just want it gone, right? They don't care how much it is. They just
Hmm.
want it gone. And you're talking about, you know, hundreds of thousands worth of equipment that they just wanted out of there. They just needed the
They
space.
just need the space.
Yes.
Mhm.
So I went in with a moving crew and I bought it for, you know, peanuts at the time. And I wish
Hmm.
I'd actually lowball them. I'm sure they would have taken a lowball. They just wanted it gone. And I moved all that equipment to a storage facility for like 2 years before I even
Before you
started.
can build up your state of the art.
Yeah, yeah,
So I mean, you're like what you have there is like I said is state of the art. Now, when people think of fertility and treatment, they have this concept in mind, so there are a few steps that it requires, which
right,
is being seen by the
yeah,
doctor, getting their medications
yes,
and like the retrieval and, you know, but with you and with Montgomery Fertility Center, they can get it all done right there.
right there. So since I've consolidated everything, I do I have my own procedure room. I have my lab, so we don't have to drive to a different facility for an hour and a half to do the retrievals, and then an hour and a half to come back to the office
Mhm.
or have the patient go travel. Everything's all here.
Yeah.
And one of the things I've done, and I still do, is to make sure I keep up with whatever's new, and I make a conscious decision
Hmm.
to invest in it, right? I
Hmm.
mean, you know, some things you'll buy you'll never touch again, and they cost you maybe 30,000. But hey, as long as you make the commitment that you will keep improving, then that's just par for the course. That's, you know,
Absolutely.
that's what you needed at that point. It may be, you know, you move on to something else. You have to invest in it, right?
Mm,
So
absolutely.
you know, invested in an electronic witnesses system, it's an investment,
Yeah.
right?
So,
In,
but with that though, it keeps you at the cutting edge and it keeps
yeah,
everything precise. And it also gives you the highest quality,
yeah,
which now, we're going to move into this segment about the egg donation. When did
correct.
you start to see that there was a
Yeah,
problem
yeah,
and that this is a problem that needs
mm,
solving? And
yeah,
like you're going to be one of the people that
right.
solve this problem.
So, you know, a lot of times patients we would, we actively recruited donors at one point,
Mhm.
and I think with the advent of social media and the internet and all that, those donors just didn't come the regular way anymore, right? I guess
Mhm.
everybody's on TikTok or whatever. But also patients were having a difficult time picking eggs. So we started by having them buy frozen eggs from other egg banks.
Mhm.
But it all came to a head around when COVID started, when these egg banks themselves dried up,
Mhm.
and my patients couldn't get the donors that they wanted, or they'll say, well, we only have 3 eggs left of this, and if you want it you would have to mix it with a different batch, and
Mhm.
that presented a unique problem, and patients were having to wait.
Mhm.
So that was one aspect of it. The other aspect is we do have a lot of donors. I mean, regular patients, African Americans, Africans, Asians, people of different minority backgrounds. So some of those patients will have um, embryos that they no longer want to use, and so we also have a bigger pool of embryos that are being offered for donation. Now,
Mhm.
most clinics will tell you if patients want to adopt embryos and they want their embryos to be of African descent, for instance, or they
Mhm.
want a Sri Lankan embryo, right?
Mhm.
Those are hard to come by. And
Mhm.
those centers will say, well, we'll look for you, but be prepared to wait for up to 3 years, right?
Wow.
So we have enough of that sort of population where, yes, you know, they're still difficult to come by, but chances are we can look through and pair you with some embryos that have been offered for donation. So it gave my patients
Yes.
another alternative. So I
Yeah.
can service them and say, well, why are you waiting around for 3 years? Come over here and see if you like any of these donors, right?
Right.
So,
Right. And be able to, and the thing about it, like, we're saying this, but these are people who are trying to start families.
correct.
I've even seen this online, as you mentioned. I remember seeing if even in like physician groups,
Mhm.
someone that's mentioning, we've tried to start our family. We would love to expand. And, we've been trying now. It's been like years and years, and we're still unable. And we would love to have our family look as similar as, and this
Yeah,
person was from, I think that they were from like an Asian descent.
yeah,
And the same thing. We are told we do not. There aren't any. There aren't any there. And
right,
luckily, there were people who have met you before who placed your name on there and says, "Try Dr. Oluyemisi with Montgomery Fertility." And I mean, when we hear these stories, it's really heart wrenching because people
right.
are spending thousands of dollars
Yeah,
searching, and what's even worse is that their hearts are being broken
correct.
because they're unable to expand this family that they're looking
Right,
forward to
right,
so
right.
much to expand in.
Right. So yeah, it's a big issue for, and it has nothing to do with socioeconomic status, right?
Mm-mm,
So professionals, doctors, lawyers, athletes, um,
mhm.
you know, there's still that human need,
Absolutely.
and so we were able to offer it to our patients and say, come on here, let's take a look at this, let's work with you.
Hmm.
And also one of the things we do is we like to do more of a one-on-one, hold your hands kind of thing for our patients, because we hear their stories, and some of us have walked in their shoes,
Yeah.
and you can hear their pain, and I
Hmm.
dare say you can sometimes feel their pain.
Hmm.
So it's just such a huge privilege, I think, to be able to help these patients out.
Absolutely. Absolutely. So, when you are here
Mhm.
and someone is here watching and they're probably, dealing with something, or they have a family member or a friend, and they're thinking, well, what would be like some of their first steps
Mhm.
to even getting some of this care? Because some people it might still be hush hush. Well, I don't want anyone to
Yes.
know. And then,
Yeah.
I'm dealing with this pain in private. So
Yeah.
what would your advice be to that person? Like, as a first step, like, hey, this is
Yeah.
the first step.
I think you hit it on the head. There's a lot of shame still. There's a lot of
Mm-hmm.
agony in privacy, right?
Mm-hmm.
Women are suffering and they're being put upon, and I don't judge their background or judge them, but
Mm-hmm.
sometimes families are dissolving, marriages are dissolving on this very issue.
Yeah.
So one is a good first step. Certainly, if you know about us, reach out to us. But I have a lot of colleagues who are primary care friends, and
Mm-hmm.
they've been around me long enough to know what I'm talking about,
Mm-hmm.
and they can be my ears and eyes, and they will text me, call me. Dr. Dochi is one who has a great health network. Dr. I call her Dr. Kwesami. She has a huge webinar that people log in from Africa, London, from America, and they're all thirsting for information. So
Mm-hmm.
I have that network of friends and OBGYNs that know me and know what I do, and can and send patients to us. And if all else fails, just talk to your primary care doctor.
Mm-hmm.
Say, hey, listen, this is what's on my mind. Can you point me in the right direction? And most primary care doctors who are busy will at least know someone they can say, hey, listen, try this, or try this facility.
Absolutely. So I know that, like, there are women and the age, they're thinking, okay, well, I have time. Or we have some women who are like, listen, I still have so much more schooling to go. I have so much more training, and I don't want to not be able
Absolutely.
to
Yeah.
co-
So
talk. Let's talk to those ladies.
let's talk to them. Let's talk to medical students, right? Let's
Yes.
talk to female medical students. Let's talk to medical residents, female
Mm-hmm.
medical residents, surgical residents. This, you can kind of have your cake and eat it too. You
Mm-hmm.
know, take a couple of weeks. If you get a couple of weeks off, 2 weeks,
Mm-hmm.
right? You can strategize, take 2 weeks off, freeze your eggs, right? So
Mm-hmm.
you can now have that choice when you're in your 40s or 30, late 30s and say, gee, I froze my eggs when I was much younger, when I was 32, and now is the time, right? And now is when I want to go ahead, freeze your eggs. Now, I also have couples who are married, so it's not like they need to freeze their eggs or anything, but they come to me and say, well, Dr. Famuyiwa, this is it. We're married. We're not going anywhere else, but we're not prepared to have children. And I said, well, why don't we freeze your embryos at that point, right? You're married, right? So you're not,
Mm-hmm.
dating anyone else. Let's collect your eggs. Let's fertilize it. Let's check to make sure they're genetically normal. And then you
Mm-hmm.
can freeze them.
Mm-hmm.
And then when you are ready, when all the stars align in a row, you can now go get those embryos and implant those embryos and start your family.
Yes, absolutely. Absolutely. Given the option of hope and to be able to know that all is not lost, especially like we said, families who are just starting out and you're like, I would love to have the opportunity to have the healthiest
Right.
um, children possible.
Yeah.
Or if you're a female and you are in training,
Right.
I mean, training is stressful. It's hard. You know that there are long hours. There's more and more time, and
Yeah.
so if at that point you haven't been in that committed relationship, but you want to, and you know that you will
Right.
be within like the next couple of years, and you want the strongest and the healthiest
Yeah.
possible option to be able to have the strongest possible
Absolutely.
healthiest child, then these are options. Now, the thing about it is that this is something that is not being talked about
Mm.
in even I mean, we are medical doctors.
Yes.
We went to medical school, we did
Correct.
training, but even in our own specialty, the
Right.
female residents aren't really exposed as much to
Right.
this option.
And then that's like one of the side things I do is I love to mentor. It's just something I do. It's
Mhm,
enjoyable. So I talk to my pre-med students, I talk to residents, I talk to medical students. I say keep it in the back of your mind,
mhm,
and even outside the field of medicine, lawyers. I have a bunch of
yeah,
lawyers. I also have people in the actors in the entertainment industry, um,
mhm.
professional athletes. They're in the same boat, right? They're
Yeah,
training,
everyone, age is happening to all of us.
right? They're training for the Olympics in the next
Mhm.
4 years. You know, they need to do stuff, and life
Yes.
is going on. So yes, so you can try to, have options.
Absolutely, absolutely. Alrighty. So now, I love that you're able to really tell us about what we're seeing out there, like the 1 in 5 who are battling
Correct.
infertility, the amount of donations and egg embryos, especially there for minorities, that's been down. It's even,
Yes.
less since COVID. There are just so many things, but there are also options that are out there. And you have been able to help a lot of people within that realm to
Right.
know that, listen, we have, if you are looking for an egg bank to fit, and you have a certain criteria, try, come to us and talk. Do not give up hope. There's a possibility. We're still here, and there are options that are here for you. And we're also been talking about like our professional students, especially the females that are out there, like we said, athletes. If you're in professional school, long training, actors, you want to be able to have that option of a healthy family when your eggs are at the best. We know that once you, let's just be real, women. I mean, age is just, it is what it is. Once we hit 35, it starts going down. Once you hit 40,
It is what it is.
It is what it is. So
Yeah.
therefore, you know that these options when you're in your late 20s, your early 30s, these options are available when you have that strong, viable egg. We're born with certain amount of eggs. That was it. Dr. Oluyemisi loves embryology. She knows that, listen, once you're born, you have all the eggs that you're gonna have, like no more, right?
Right.
And so as you get older, you still have your eggs are just as old as you are.
Yes.
It is what it is, like doctors. So you want to be able to have the strongest and healthiest options. And these are, you know, it being able to freeze your eggs while you are still at that viable, strong age is possible. Now, I know we might have some people who are listening who are like, well, I was able to do this. You know, this is science. That means it's not 100%. You're going to have people at every end of the spectrum, right? But we're
Right.
talking about those in the middle and the person who we want to provide the information so that you have these options and that you can benefit from it, right? We're not talking about the people at the end of each curve. What about like those who want to be able to help, to be able to
Exactly.
get these options?
Exactly.
So one of the things now I want to know, I mean, all of this, Dr. Olimisi, is a lot. Bench research, starting your own clinic, being able to secure the top end equipment that rivals the Ivy League because you invest in it. Your investment in your clinic is producing some of the top numbers that is even better than some of larger clinics, larger than some of the Ivy League um, institutions out there.
Yeah.
All of this can take a lot. Have you ever burned out? And if so, what is it that you're doing to prevent yourself from there?
Yeah. So I think that we're all human beings. We can get
Absolutely.
tired now and then. Um, but I think that taking taking a few days off. For instance, I just took a vacation that was just so relaxing. Um, it's always good to take a few days off, even if you can't take a whole week off. Take a
Mhm,
few days off. It's so refreshing,
mhm,
is what I've found out. Just take some time off
mhm.
and
And I
do.
know that another thing too, you do a lot of gratitude practicing,
Yes.
you know, about like gratitude. And gratitude practice is something that you do very often, even when you find yourself in the moment of being like a stressful. So tell us about like, you know, like your journaling and being able to really to pull in how grateful you are to being able to help. Like what are
Yeah.
some,
So
yeah.
for me, I love reading. So
Mhm,
I love, different forms of reading. I like, nonfiction,
mhm.
fiction. So for me, being in a garden where I can read forever and a day is my idea
Ooh,
of
I love
Eden.
it.
So I
Yes.
love reading. So that's what does it for me.
Love, love, love. All righty. So vacation, taking a couple days off every once in a while, understanding that you might not be able to do weeks or months, but
Right.
also your short term, quick go to is to be able to read, immerse yourself in the stories, pull yourself from what's going on right now, bring that relaxation and really strengthen it. Love, love, love. Alrighty. So, you know, this is my fun question of the day. And I ask all of my guests this question.
Okay.
Alrighty. If you weren't a doctor, embryologist, reader, and I'm going to pull this out because I know you like to write.
Yes, I do.
Yes.
I
You,
like to blog
what,
the
what
moment.
would you be if you weren't able to blog, if you weren't a writer, if you weren't a doctor, an embryologist? What would you be?
I don't know what I'd be. I've always wanted to do what I do now. Maybe I might be an author. I like to write.
So you'd be
Well,
an
I like
author?
to read.
Huh?
So maybe I'd be an author. You never know.
I think you will be. I don't think it's that you never know. I know. I feel it in my bones.
Yeah.
I know you will be an author, and I know that you'll be providing like great information for those out
And
there
yeah.
who like to break down complex medical issues into very simple terms so that your patients can understand, so that they feel well empowered, when they leave you. So I know there's a book in there. It's coming.
Amen.
You heard it here first.
Yes.
As the 200th guest interview, physician interview on the Dr. Tamara Beckford Show, Dr. Oluyemisi, she's going to be writing a book.
Thank you very much. Yes.
So I know a lot of
You
people
help
have
me
been
lunch
watching. Oh, what did you say?
it. You help me lunch it.
Oh, there we go. We will launch it. Absolutely. So we have those who are watching, and they're thinking like, oh my gosh, this is really great. I love the fact that you have your all-encompassing clinic. I can do everything there. It's private. No one needs to know because it's highly confidential what's going on. And I can get it all done in one place.
Yeah.
I'm not traveling here, there, and everywhere.
Right.
How can I find you? Like, where are you located? Like, how can I get in contact? How can I wait a minute? How can I make an appointment? Just tell me everything, all the things.
We're in Rockville, Maryland, the wonderful
Mhm,
city of Rockville, Maryland. Very nice, like feels like a home village, if you will.
mhm,
But the best way to get me is to send an email to
mhm,
frequently asked questions at MFC, which is FAQ
mhm,
MFC@gmail.com.
mhm,
FAQ, frequently asked questions, MFC, Montgomery Fertility Center at gmail.com. Or simply go to our website,
mhm.
Montgomery Fertility Center, all one word.com.
Love it, love it. So if you have a question after this interview and you're like, I really want to know, I've thought about it. I know someone who has. This is something that I've been dealing with that I haven't told anyone. My, partner and I were wanted to start a family, but we're unable to. This is something that I feel like I would like to delve more into. Then you can do FAQMFC@gmail.com
Correct.
or go to MontgomeryFertilityCenter.com, all one word there, and you'll find all things that's Dr. Oluyemisi, all things at Montgomery Fertility Center. Be able to connect with her wonderful team, her wonderful staff, who will be there to guide you. And personally, you'll get personalized attention because that's what she
Yes.
does. That's
And
what.
by the way, center is spelled the American center with the ER,
Okay, yes. If
not,
you are
not the
any of the
British
British,
center.
yes, if you are in Canada or anywhere that's under the British system, yes, it's the CENTER.
Correct.
CENTER. So she's looking forward to hearing from you. Thank you so much, Dr. Olimisi.
Thank
Do you
you.
have any last minute
No, no.
words for those who are listening or those who are watching?
So I always tell my patients, here's one thing I tell them. Really, it only takes the golden egg. It takes one golden egg. So
Mm,
don't give up. It takes that one golden egg. I've had many patients who have one egg, one embryo, one blast, one baby. It takes the
wow.
golden egg.
Love it. Love it. So do not give up.
Right.
You have someone who's on your side. Thank you so much, Dr. Oluyemisi, for being my 200th physician guest.
Thank
You
you. What
are
an honor.
so,
Thank you.
what an honor for you to be here with me. I can't believe it. You took the time out from helping these wonderful families to have the dream life, the life that they are so deserving, that they've been looking forward to. You took time out from that to be on my show. Thank you so much for blessing us.
Thank you.
Hey, it is our honor. So, for those of you guys who are on and you're like, oh my gosh, I'm just getting the end of this. I didn't even find out where this is. You know what? Have no fear. Dr. Olimisi's interview is available on our URcaringdocs website. Just go to URcaringdocs.com, select podcast, and you'll be able to see her. Just see her beautiful face. Just click listen here. All of that will be available. If you're a doctor and doing amazing things inside and outside of clinical medicine, just like our wonderful guest, and you would like to be on the podcast, hey, send me an email at drbeckford@yourcaringdocs.com. That's Beckford at yourcaringdocs.com to book. Keep in mind, we're booked out 3 months in advance. Why? You see why, right? Look at my wonderful guest. Look at all the amazing things that she's doing in clinical medicine. There's so many wonderful doctors like that. And I would love to highlight you all. So do not hesitate to send me an email, drbeckford@yourcaringdocs.com to book. And I would love to have you on the show. Thank you so much, Dr. Oluyemisi. Thank you so much to the Montgomery Fertility Center, Rockville, Maryland. Thank you guys for being a wonderful guest on my show. And I will see you all who are watching and listening. I'll see you guys next time.
Thank you.
Bye.
Bye.